So this is continuing from shoeing. So yeah, one type we can have are wooden shoes or clogs, kind of is self-explanatory, but just a few things. So it has a squared off toe, and you can see generally there's a 45-degree bevel all around its perimeter. The whole idea is that the ground surface is smaller than the foot surface. Why is that a good thing? Well, it's good in the case of, say, solar prolapse, so prolapse of the sole is quite obvious. And basically what you might have with this as well is you might have recessing of the dorsal solar surface. So I assume this is this for horses with solar prolapse. And the shoe is also simple to make and apply. Now, 4-point rail shoes, now this is a bit different. So as you can see, the toe of the shoe is squared. It says aggressively rolled and broadened, so I think just like wider. And what you have are narrow wedges called rails. So I think these are the narrow wedges they're referring to. The rails are applied to the axial side of the ground surface of each branch to raise the heel. So basically these narrow wedges called rails raise the heels, and it incorporates both two things. It eases breakover at the toe and it elevates the heel, so it has two advantages. The axial rails as well also improve the medial and lateral breakover. Yeah, so it just shows a regular modified toe squared shoe with additional frog support. So it's a bit like the heart bar. Now, when it comes to the deep digital flexor tenotomy, it's quite simple, really. So it can be performed in the mid-metacarpal region. So basically the middle of the, let's say this, the middle of the forearm, in the mid-pastern region. Tenotomy in this, in the mid-pastern provides greater mobility of the foot, so they can like move it more, and it can cause instability of the DIP joint if, you know, not done really well. So basically it's showing here, you do the incision here on the palmar side. So anyway, you perform x-rays, of course, while shoeing immediately following this procedure of the dorsal digital flexor tendon. I need to remember this, to assess both the, you need to see how well the distal phalanx has been realigned, so the distal phalanx in the hoof to the ground surface, and you need to apply increasing degrees of heel elevation with the shoeing, and that can be assessed with x-rays using until the subluxation is resolved. Oh dear. And the aim is to also decrease pressure in the hoof. So this is, for partial dorsal hoof wall resections. You know, you're probably wondering, why would you remove parts of the hoof wall? Well, you want to decrease pressure in the hoof and pain. And you want to get rid of any necrotic tissue that might be on the outside as well, and remove the laminar wedge to encourage the hoof wall to like grow more and encourage the realignment of the distal phalanx inside the hoof. Oh dear. So in terms of this is the name of the procedure, coronary band grooving and resection. Oh, I can't speak. Coronary, yeah, you can read it. I can't though. Apparently, so the groove is created in the dorsal hoof wall at the level of the base of the extensor process, and it extends through the full thickness of the stratum medium of the wall from one toe quarter junction to the other. Why do we do this? It's to take pressure off the coronary band, so off of here, to increase the rate of the new hoof wall growth. So we're trying to make this grow more basically by removing pressure off the coronary band, and it creates creates discontinuity between older, more distal hoof walls and the more newer proximal wall. So what does that mean? It creates more of a continuity between the outside of this wall and the more inside part of this wall, so that the distal part of this wall is less likely to distract the new hoof away from the distal phalanx, basically, inside the hoof. God, that was hard to say. So yeah, in terms of prognosis, how this is going to go, it's desirable to remove the heel elevation if we've ever introduced it. Like, you know, we mentioned the rails in one of the shoe types, as soon as possible when the horse is comfortable. So yeah, just make sure the horse is comfortable before you remove these types of shoes, because they're purely orthopedic and helpful for that. And yeah, you want to see them landing on the flat foot to limit the contraction of the heels, usually after 3 to 6 months. And the sole support, so the support of the bottom, may be removed gradually between 4 and 8 months. And the most successful cases return to near normal shoeing or barefoot trimming between 8 to 12 months. So yeah, it seems really long. And horses that have over 15-degree distal phalanx rotation, so we said the distal bone in the hoof, if it's too rotated, you need more than 6 weeks in this condition. If you had more than 6 weeks of basically this, you have a bad prognosis. So yeah, just to recap, just the first bullet point because it was quite a mouthful. You need to remove the heel elevation ASAP when the horse is comfortable. And how do we know that? It's landing with a flat foot, and it's usually around the 3 to 6 month mark. And then you remove the sole support in a gradual manner between 4 to 8 months, and the most successful cases return to near normal 8 to 12 months. Okay.